3. Hey, this is John Carrots. I'm here on OSH Radio. I'm here with Dan Elton, one of my fellow members from the Transhumanists Party. And I think I've known you now a couple years now, Dan, I think. Dan's an interesting guy. I haven't let him talk yet, but he's got his PhD in physics. He lives down here in Bethesda, Maryland. Nice place.
Yep.
And tell us about yourself, Dan. What got you interested in physics in the first place?
Well, I think I got inspired to go into physics from my father, who was a chemical engineer, and we used to do experiments growing up. One of them was we actually made hydrogen gas from sodium hydroxide and aluminum. Yeah, my dad really got me interested in science, but actually through most of high school I was more thinking I was going to go into engineering. What got me interested in physics in particular was Stephen Hawking's book, Brief History of Time. And then when I went to college, I actually started in engineering, but I didn't like the first semester course load, so I switched into physics.
I think some people would consider engineering easier than physics, to be honest with you.
They're both challenging, require a lot of math, but physics often is more math. Yeah. So.
That's interesting that your dad was a chemical engineer. Actually, I started out my career as going to be a doctor. My dad was an electrical engineer, and I decided I didn't want to have to worry about people dying, so I went into engineering, and I tried to go into chemical engineering, but in my day they were big on syn fuel research against synthetic fuel, and you had to have like a straight 4.0. By the time I was finishing my master's degree, though, in environmental engineering, you could get into chemical engineering with a C. It was interesting how it changed, but interesting how things changed. So that's how you got interested in physics, and so then tell us a little bit about your history for work. I know you're here down here right now working for NIH.
Yep.
And how did you get that?
Well, it's a long story, but
that's what we're here for.
Yeah. Well, if you want the synopsis, I did my undergraduate in physics, and then I was for a short time thinking maybe I was going to get into theoretical physics, but I quickly found out I was really not cut out for that. Just don't have the mathematical ability, and that's a very, very tough field. So then I was looking into quantum computing for some time. This was back in like 2010. And ended up doing my PhD research doing molecular dynamics simulation of water molecules, and I was looking at how water absorbs microwaves and infrared light, and what actually happens on the molecular level with the vibrations of the molecules and stuff like that. But I got really burned out with that research. Graduate school was not a good time for me. So I really was looking for a change when I was getting close to finally finishing my PhD. And so I decided to go into machine learning because I had an interest in neural networks. Long story short, I ended up getting a job as a postdoctoral researcher at the University of Maryland, and that's where I started getting a lot of experience with machine learning. That application was specifically looking at molecules and trying to predict the properties of the molecules and helping the Navy look for better explosives that are more dense and also more stable. So then I was thinking I was going to try to get into the pharmaceutical industry, building off of that work with the molecules. And I applied to a number of different pharmaceutical companies, and for whatever reason, none of them wanted to hire me. I think they were skeptical at that time. They were skeptical of AI. So I kind of broadened my job search, interviewed for a lot of jobs around DC and ended up getting my current job at NIH. So I've been at NIH about 2.5 years. I'm working for a radiologist in the clinical center, and he has a research group focused on AI for radiology. He's one of the pioneers in that particular area. So it's mostly doing these automated measurements. So I can go into that if you want, but
Well, it's up to you. I know also right now you're seeking a new job.
well, I got a new job.
You got a new job in Boston. How long are you going to be going? What, in the next couple of weeks you're going to be going?
I'm moving in about a week and a half.
That'll be here fast, but this is more what you wanted, this new job.
It's a
step in that
it's a
direction?
step in a more applied direction that is, I believe, more impactful work. Yeah, the stuff I've been doing is, a lot of it's been pretty cool, but it's all proof of concept type work, where none of the AI systems are actually deployed into real world use. They're just tested on small data sets, and then we do publications on that, and that's basically it. So I've been interested in actually deploying AI and really seeing how it works in the real world, where you can have more diverse data sets, and seeing how doctors interface with the AI. I think that's going to be really interesting. So I managed to get a new job at Mass General Brigham, which is a conglomeration of Mass General Hospital, Brigham's Women's Hospital, and a bunch of other hospitals in the Boston area. And at that position, I'm going to be helping them deploy AI, mostly commercial AI products, but also some academic research software. And we're going to be deploying it into the radiology clinic and then testing it.
I'm glad for you. It's always good when someone moves in a direction where they're happy about it.
And I love the location too. So
there you go.
That's a big reason.
Okay, it is a beautiful place in Boston.
It's a big part of it.
That's great though, and you're going to be closer to the family and also too. That's great. Now I know you from being in a transhumanist organization.
Yep.
What can you tell me about your your involvement in that, and how you got involved in that, and what you like best about that?
Yeah, well, right around when I started my job at NIH, I was really looking for a community to join, and just trying to find like-minded people. So I started my own little meetup just right near here in Rockville, which I call Rockville Futurists.
Oh, that's nice. Actually, is that part of the actual meetup groups on
Yes,
the
it was a
internet stuff?
meetup.com meetup. But very few people were coming to my meetups. So then I found out there was another meetup called the DC Transhumanists Party. And I reached out to the organizers of that, and they actually made me a co-organizer. So that's how I got into the Transhumanist Party. Prior to that, I had actually followed Zoltan Istvan and his campaign, and I was one of the original donors on his Indiegogo and everything. So I had known about him, but I hadn't really followed the Transhumanist Party as it had developed afterwards. But that's how I got involved, was through the DC Transhumanist Party meetup, and then got involved in the primary and just found that actually the people online were kind of, very interesting characters like yourself.
The character, that's me.
So it's actually hard to find transhumanists and futurists in this area. So
And do you think they're not here, or do you think they just don't want to be in groups or something?
I just think that the culture here is very it doesn't attract those kind of people.
That's interesting. I just wonder if they're not in secret.
I think there's a lot of people
transhumanists
who are sympathetic to aspects of it, but you don't find the really committed people like you would find in the Bay Area or somewhere like Boston, who are real like techno-futurist visionaries and stuff.
Are there some organizations in Boston too already? Have you scoped that out?
There is a large transhumanist and futurist meetup in Boston.
Oh, that's cool. That's great.
I don't think the USTP has any organization there, but
not yet. But you're going to make that happen, right?
I may fix that.
Now I know you're also active on Clubhouse too.
Yep.
And I first learned about Clubhouse from you, and I'm on there now too.
Yeah.
I do a lot of this stuff with the meditation groups and music groups because of my like for music actually.
Oh yeah, I've seen you on there. Yeah.
But I've seen you on there with that one meeting with the nice transhumanist group talk. That was a pretty good talk. I enjoyed that. Had a lot of good people on that one, and
yeah,
that's great. Hopefully, there's going to be many more of those.
Well, I've only done I think like 2 events with the Transhumanism Club. Haven't had time to do regular rooms or events, but
I'll give you some time.
There's actually a lot of followers now, and I think it's got a lot of room to grow, so it's exciting. And Transhumanist Party has a club as well, which I co-founded. Daniel Twett.
I think I joined, if I remember. I think I did.
Yeah, you should be in there.
But now I think you also had some things you wanted to talk to about the FDA.
Yeah, so the FDA is something I got interested in because I was trying to figure out why they hadn't approved the AstraZeneca vaccine. I don't know if you followed that whole saga, but the AstraZeneca vaccine was approved in December 30th in the UK, and there was a lot of data supporting it. They had a really good phase 3 trial. AstraZeneca did make some mistakes during the trial, but the data ultimately was really good. So I was around early February. I was wondering why AstraZeneca vaccine had not been approved, and then I found out that there actually were at that time about 20 million doses already manufactured in Baltimore that were just sitting there. And this was at a time when there were about 5,000 people dying every day, 5 to 10,000. So I was really, really wondering, why aren't we using these vaccines? So I still haven't figured out why, but they never approved AstraZeneca. But I ended up doing a lot of research on the FDA, and I think there's a lot of room for reform, especially with vaccine approvals and how they operate in emergencies. They should have approved things way faster than they did during the pandemic. So, for instance, Pfizer vaccine easily could have been approved. It was actually on track to be approved in early November, but because of actions the FDA took, it got delayed till late November. So Pfizer vaccine could have been approved earlier. They could have approved AstraZeneca. They could have done half doses of Moderna. There's just a number of different things they could have done that would have saved tens of thousands of lives that weren't done. So
what are your thoughts on why that wasn't done? Do you have any thoughts on it?
Well, there's not a good incentive structure there. So because they don't really get pushback when they fail to approve something that would have saved a lot of lives and then people die because of. But if they approve something too uncareful, too quickly, or and then something goes wrong, like there's side effects that were unexpected, then they get a ton of pushback, right? So there's kind of like a fundamentally.
So they're kind of rewarded better for taking their time.
They're rewarded
it's safer.
for having excess caution.
Yeah, exactly.
Caution.
Yeah.
Yeah, it's not really set up to deal with emergency situations or situations where people are dying. Time is basically
So what do you think would be a
lives.
solution? What kind of things do you think might possibly be implemented to resolve some of these issues?
Well, as far as the operating better in the pandemic, there should probably be more careful cost-benefit analysis where they actually take into account like the effects of delay and waiting. Actually, do a kind of cost-benefit or risk-benefit calculation to
Like how
figure
many
out-
lives are saved
Yeah.
versus how many might be impacted the other direction.
Right, and they have a lot of authority to operate in like an emergency with the emergency use authorization. They just didn't utilize that authority to the extent they could have. So that's one thing. There should probably be right to try for a lot of life-saving medications drugs that are under development. And for vaccines during a pandemic, there should be right to try and then what they could do is for people who want to try the vaccine early when it's say going through the phase 3 trial, they can actually monitor those people and collect data from them, and that's relatively cheap to do. So.
But it's not just the COVID thing, it's all the process for other drugs and everything else. You feel it's
Right.
just the process they use could be improved overall and help people with a lot
Definitely.
more things than just this.
Yeah, so I think, but as I learned more about it, I realized that the process, the level of regulation they use varies a lot between different divisions. So cancer drugs are probably approved too quickly without enough proper endpoints in the trial, but then for other types of drugs like this ALS drug, the regulation's probably way too high, and they require like 2 phase 3 trials for a lot of these drugs, which take like 5-10 years. So that is a huge burden in terms of the cost, and also in terms of people who are suffering waiting for the stuff to be approved. So it's complicated. There's not I don't think there's one regulation that's going to necessarily fix all of the problems, but I think there's a number of easy things they could do. They could do what's called reciprocity with other agencies. So if there's another agency in Germany or Canada which has they approve something, it could automatically be approved here. That's pretty non.
That would be nice. I always think this country doesn't trust other countries though, but I know people that have lived in different countries and they notice how the drugs that are approved one place are very different than other places. And that would be nice. I'll tell you another thing I'd like to ask you though, Dan. I mean, I didn't mention this before, but we talked about you going for a new job. We talked about your desire you hope there's things different with the FDA. Say, for Dan Elton, in 5-10 years, where would you like to be? How would you like your life to be different? And what would you like to be doing?
I hope to do more writing. Honestly, I realize writing is very rewarding. And you can have a big impact with writing. I feel like with the work I've been doing, a lot of these publications that aren't really being read by anyone. Whereas my experience with writing that I've done is you can spend a day writing a blog post and it can be read by a couple hundred people, and gets or more, potentially a lot more. So I hope to do more writing and
Actual publications, books or blogs or what
probably
kind of...
a lot of blogging on topics that I'm interested in.
And as far
AI
and as far as the transhumanists things, what items do you think are the most pressing that should be looked at? right now? What if it was up to you? What 2 things would you like to tackle tomorrow if you could?
Well, I think the centerpiece of the USDP policy has always been radical life extension, and that is something we could really expedite with better government investments. I mean, we have National Institute of Aging right now, but they're mostly spending money on Alzheimer's research. So if they could target their investments a lot better, maybe provide grants, startups, and really invest in gene therapy and things like that. So I think as far as government policy, I think one of the big things that is investment in biotechnology, genetic engineering, longevity biotech, reducing our cutting the defense spending and putting it into that would be enormous benefit to humanity. As far as other things, I'd like to see more work on AI safety, AI existential risk reduction.
Education. Education's
obviously,
always good.
Yeah.
I think if we don't teach the people, I also think the education of youth is important, because if we don't teach them to be interested in things, it's not going to carry over.
Right.
And my own experience with education is a lot of people and a lot of companies talk the game. When it comes down to it, they don't really walk the walk. They say they're going to help with education, and they don't. But other things come up. But yeah, education, I would really like to see that too.
Well, I'd like to see it so that the quality of schools is not tied to, the local economy and like what neighborhood you grew up in. It should be, obviously.
Well, it's a pity it
There needs
is.
to be more equity in school.
And also what they like to teach seems to be based on the economy also.
The geography, yeah.
Which is a pity in itself.
Yeah.
I tell you, Dan, I told you I wouldn't keep you too long. Now, my question for you in ending is, now if people wanted to read more about Dan, where are the blogs you write on, and where can they read some of your stuff and find out about you?
Yeah, I have a website, www.moreisdifferent.com, where I have a lot of my older blog posts from years ago. But just recently I started a new blog, which is moreisdifferent.substack.com. And that's where I've been writing about the FDA and some of the reform ideas, and hope to write more there in the next few weeks.
So that'd be great.
Yeah,
so,
and also follow me on Twitter.
And Clubhouse?
Not so much on Clubhouse anymore, but feel free to follow me there. So, yeah.
Follow you anywhere they can find you, and read your blogs and stuff. That's great. Well, thanks for being with us, Dan.
Okay.
And I'll say goodbye here myself. Nobody's seen me yet today. Hey. So
all right.
Thanks for being with us, and we hope to talk to you more in the future.
Sure.